Tobramycin sulfate vial is a medication that can be used to prevent or treat a wide range of bacterial infections. It belongs to a class of drugs known as aminoglycoside antibiotics, and it works by stopping the growth of bacteria. It is important to take the medication as prescribed by your healthcare provider to ensure its effectiveness. The daily dosage and optimal timing for taking this medication will depend on the specific condition being treated, so it's important to follow your healthcare provider's instructions carefully. When using tobramycin sulfate vial, it is typically given by injection into a vein or muscle every 8 hours as directed by your doctor. The dosage will depend on your medical condition, weight, lab tests, and how you respond to the treatment. If you are administering this medication to yourself at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using it, visually inspect the product for particles or discoloration. If you notice either of these, do not use the liquid. Also, be sure to learn how to store and dispose of medical supplies safely. For the best results, it's important to use this antibiotic at evenly spaced times. To help you remember, use it at the same time every day. Make sure to continue using this medication until the full prescribed amount is finished, even if your symptoms start to disappear after a few days. Stopping the medication too early could cause the infection to return. If your condition persists or worsens, be sure to inform your doctor. Some side effects of using tobramycin sulfate vial may include nausea, vomiting, stomach upset, or loss of appetite. You may also experience pain, irritation, or redness at the injection site. If any of these effects persist or worsen, please consult your doctor or pharmacist. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as numbness or tingling, muscle twitching or weakness, or seizures. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as persistent diarrhea, abdominal pain or cramping, or blood/mucus in your stool, it's important to seek medical attention. Do not use anti-diarrhea or opioid products, as they may worsen the symptoms. Prolonged or repeated use of this medication may result in oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. A serious allergic reaction to this drug is rare, but if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing, seek medical help immediately. This is not a complete list of possible side effects. If you experience any other effects not listed here, please contact your doctor or pharmacist. It's important to be aware that tobramycin sulfate vial can potentially cause serious kidney problems and nerve damage, which may lead to permanent hearing loss and balance issues. The risk of these side effects is higher for older individuals, those with existing kidney disease, or those experiencing severe dehydration. Additionally, receiving high doses or using the medication for an extended period of time can also increase the risk. If you notice ringing or roaring sounds in your ears, experience hearing loss, dizziness, or a significant decrease in urine output, it's crucial to inform your doctor immediately. Your healthcare provider will conduct regular monitoring to reduce the likelihood of these side effects, which may involve hearing, kidney, urine, and drug blood level tests. It's also important to avoid other medications that could heighten the risk of these serious side effects when taken alongside tobramycin. Before using tobramycin, make sure to inform your doctor or pharmacist if you are allergic to it, other aminoglycoside antibiotics, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Also, inform your doctor or pharmacist about your medical history, especially if you have cystic fibrosis, hearing problems, kidney problems, low blood minerals, myasthenia gravis, or Parkinson's disease. Tobramycin may affect how well live bacterial vaccines work, so be sure to inform your healthcare professional before getting any immunizations or vaccinations. Before having surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the effects of this drug, especially in terms of kidney damage. This medication is not recommended for use during pregnancy, as there have been reports of harm in babies born to women using similar drugs. The risk for harm may not be the same with this drug, so it's important to discuss the risks and benefits with your doctor. This drug passes into breast milk in very small amounts. However, many doctors consider breastfeeding safe while using this medication. Consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication, always seek approval from your doctor. It's worth noting that other medications that may affect the kidneys or hearing could increase the risk of kidney damage or hearing loss if taken with tobramycin. Some of these medications include amikacin, amphotericin B, citalopram, cisplatin, polymyxin B, cephalosporins such as cephalosporin, and nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. Always consult with your healthcare provider to ensure the safe use of tobramycin. If someone has taken too much tobramycin sulfate vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while Canadian residents can reach out to their provincial poison control center. Your doctor may order lab or medical tests to monitor your kidney function and drug levels while you are using tobramycin sulfate vial. It's important to attend all medical and lab appointments as scheduled. Be sure to consult your doctor for more information. Be sure to take each dose of tobramycin sulfate vial as directed by your doctor. If you happen to miss a dose, consult with your healthcare provider to establish a new dosing schedule. Do not take a double dose to make up for a missed one. Be sure to follow the storage instructions provided with the product, and keep all medications out of reach of children and pets. It is important to properly dispose of this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to discard it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.